Good morning. I'd like to welcome everyone to this session for Texas PRIMA, Healthy Workforce, Biggest Protection in Times of Economic Uncertainty. My name is Derek Brown. I serve as the Vice President of Client and Care Team Services with Marathon Health. Part of my role is oversight of an account team and business operations for Marathon Health throughout the Southwest and what we deem the Pacific Northwest Division. With me today, I'll kind of run through the list that you see on the screen here. We have Rosa de la Torre. Rosa holds a doctorate in nursing practice. Over the past 9 years, Rosa's held many clinical leadership positions for Marathon Health. She has a background in primary care with a focus on population health, wellness, and disease management. Within Rosa's role, she provides a great deal of clinical oversight for quality care of our patients for numerous health centers and teams throughout the Western U.S. Also with us today, we have Matt Grebliunas. Matt serves as the Director of Human Resources with the City of Lewisville in Texas. Matt started his career with Lewisville in 2013 as the benefit manager. Shortly after that, transitioning into the HR manager role. And then in 2016, Matt was promoted as the Human Resources Director for Lewisville. And with us as well from Marsh and McLennan Agency, we have Lisa Price. Lisa joined Marsh and McLennan in 2013, working with self-funded clients. She has over 20 years in the healthcare industry alone. Within Lisa's role, she manages complex clients' needs to ensure they are up to date on industry changes, compliance issues, and market trends. Lisa's expertise includes custom plan designs and saving strategies. Again, thank you everyone for joining our session today. I know it's a little different than if we could have been in person with you in San Antonio. Nonetheless, I feel we have some very relevant to-date information to share. So appreciate your time, and hopefully we'll be seeing you in person soon. Just want to give a rough overview of the agenda today. You just met our very experienced speakers here. I'll be delivering an overview of Marathon Health, worksite health in general, some of the customers we work with, the overall value proposition of having a on-site, near-site, or shared health center. Rosa is going to step in and cover our Marathon Health pandemic response, both internally and externally, from a customer, broker, and consultant standpoint, really how we stepped up to the plate back in March and, have been churning it all in to truly deliver a solid resource for our customers. Matt is then going to review a business case, for why the city of Lewisville, decided to venture towards down this road for worksite health and, the value it served with the city. And then closing us today, Lisa is going to cover, a broker's perspective for worksite health. Really the value for the customers that Lisa and her colleagues work with, and some of the offerings that Marsh McLennan has available as well. So as we take a look at Marathon Health, our map has grown a little bit recently. Earlier in 2020, we actually merged with an organization called Our Health, which is headquartered out of Indianapolis, Indiana. And with that, our business grew over 30%. So you can kind of take a look with the blue dots designated as what we term on-site health centers. So these are going to be centers that are physically located within an employer's organizational headquarters or office site. Within the more of the yellow dot, these are going to be what are called My Clinic networks and shared near-site centers. So a My Clinic network, which are mostly going to be in more the Midwest, Northeast region, these are going to be a congregation of several health centers that all have shared access within each other. So it could be, for instance, there could be 5 to 6 health centers within the state of Indiana, multiple employer groups that all share access to these at agreed upon rate. And then more of a neon green circle, you'll see more of those out towards the western United States. These are going to be travel clinic only locations. So for most of these sites, we have a working relationship with the customer and likely a health center on site in another state. But for these circles, we are doing health coaching only services for the most part. As you look at the right table, I think it's important to notate, over the past few years, Marathon Health, we are now at 200 plus health centers in over 40 states in the United States. With over 160 partners, we have an 89 patient NPS score, which on a scale of 1 to 100, I'd say that's not too shabby. Triple aim metrics, which include the likes of health outcomes, patient experience, and claims trend projections, we're at 95%. And if you take a look to the right, renewal rate, which is really a lot of what I do at Marathon Health, working on customer retention, ambassador retention, we're at 98% for our current book of business at renewal. Just want to give you all a snapshot, that we are not a cookie cutter organization designed for one specifically industry or entity. You take a look at this list, you see a few states that we partner with, several municipalities in addition to City of Lewisville that's with us today. As we go down the list, we have anything from manufacturing, we have union groups, school districts, we have oil and gas groups such as Endeavor Energy. So what is worksite health? What does Marathon Health bring to the table? So our core services, we deliver a high-touch delivery model that's patient-centric. And I think it's important to hit on that patient-centric aspect. So, it's not just acute care that we deliver within our health centers, which is, one of the main service offerings, but we truly work with our clinicians that we bring on with a tactic called motivational interviewing, where it's not just a routine office visit when they come in to see us. They're not interrupted after a few minutes of visiting with one of our providers. So we train all of our clinicians. I say we, I defer to individuals of the likes of Rosa, who's on the phone as well. We work with them to truly get at the root of what that underlying issue is, to where we can work to prevent some of those catastrophic claims, those catastrophic issues down the road. So everything from medical management, working with lab and pharmacy vendors, as well as integrating within wellness vendors or hosting our own platform that we do offer at Marathon Health as well. Some additional, I hesitate to use the word optional, as we have a slew of these services at more than half of our sites at Marathon Health, ranging from occupational health. So if we partner with the customer and they'd like us to take on their pre-employment exams, do any drug screening and breath alcohol testing, fit for duty testing, anything of that nature, we are more than capable of implementing these services. And then taking a look at more ancillary services such as musculoskeletal, whether it be physical therapy, chiropractic care, and a very new service that Marathon has been exploring and looking to implement, being in the dental realm. So how do we approach care navigation? It's not just a relationship between, an account rep, so potentially someone that works on my account team, and a customer. So take the Marathon Health Center there in the top right quadrant over on the right of your screen. So we have the health center service offerings that we have, whether it be basic acute care, maybe we do some occupational health for you. But it really takes a network of collaboration to truly make this program a success. And we like to think we are subject matter experts in driving that. So from care navigation services, we work with if you have a broker, we're likely working with them long before the implementation gets underway. We want to work with and collaborate with any benefit and vendors that you have on board. So for instance, with the City of Lewisville, a couple years ago, we hosted what's called a vendor summit. So, we find it important. We bring all of our clinical team members to the table. We invite all the benefit-related vendors and broker that work with the city, and we really sit down and, we explore all the current benefit offerings. We explore the health center, what we're currently offering to the city members. How can we truly drive engagement on all angles? How can we cross-refer amongst, each party that's designated? That's how we truly succeed. And patient-specific outreach. It goes without saying, this is a cornerstone to what we do. So within our EMR system, our providers are empowered to truly reach out to, not just the high and chronic population, but, while that is, more of a priority as we truly want to engage those members with the utmost importance, but it allows us to engage the entire population, regardless of circumstance. A new measure for Marathon Health. I think you saw the triple aim previously. Well, why just do triple when you can do quadruple? So the quadruple aim is actually a new metric that we are implementing into all of our sites across the country, which includes better patient experiences, which we covered with the Net Promoter Score earlier, improved health outcomes, which is really, when we partner with you, whether it be public sector, private sector, we want to move the needle. We say we're going to move the needle. That's our job. Improve care team satisfaction. This is your patient's visits. So our account team, we receive notifications of each visit. At the conclusion of every visit, every patient, they're asked to fill out a survey, rating, the satisfaction, rating or if they would have sought care and where they would have sought care if not for this health center. We truly try to get granular into the details and see what the population wants, gauge their satisfaction, and if something's not working, then we work to fix it. So this is taking a look at patient outcomes. And when we say patient outcomes, I don't want you to get too overwhelmed with this slide. It's a bit loud, but I'll attempt to walk you through it here. So this is kind of a snapshot of a basic reporting package that we deliver to our customers on a recurring basis, whether it be monthly, weekly, and so forth. And for our annual reviews, which we host for all of our customers at Marathon Health, we get really detailed into some of these specifics. So if I'm taking a look at the right table, I'm looking at all selected member types. So, and this could be an employer that has employees, spouses, and dependents that all have access. So we're reporting out on the entirety of the plan population. So if I'm taking a look at body mass index, we'll keep it relatively easy there at the top. We've identified through inbound claims or designation by one of our providers in the health center that 1,962 of these members fall outside of that threshold that you see for having a healthy BMI. Well, of that 1,962, over 76.4% have been engaged in coaching. So what is this engagement in coaching? Well, that is kind of the cornerstone of Marathon Health. So being engaged means this individual has 2 or more what we call coaching visits, coaching with a RN or above. For the most part, this is going to be a nurse practitioner, a physician assistant, or even a MD in some circumstances. So you can see that 76.4 engaged. And then from that, around 50%, or 38.2% making progress. And then average points improved for those is 1.7. Now, while 1.7 seems like a menial number, that is quite drastic for BMI, especially as we're an aging population. And typically we see BMI increase for the most part year over year. So seeing that significant reduction speaks volume, and you can kind of follow the trend as you work your way down the list. So I know data and projections are great and all. So, that's why I find it important to truly show you some numbers that depict, what is the savings? What is the return I'm getting? Now, granted, it may not come in year 1, But if you truly partner with us, if we collaborate and, dedicate the time needed, you can see some returns like this. So well, let's start left to right again. So we're taking all employees, okay? So all employees representative of 661, that's going to be the N we're working with here. So 661, and we're taking the average medical per member per year claim amount. So you can see we're looking at around $2,527 per member in that large bucket for all employees. And also representative there, the average number of chronic conditions that we're receiving on inbound claims, 0.9. That's a great number, right? 0.9 per member. I mean, that's good. Now let's get into what some of this may look like. Okay, with 0 coaching visits, you see how that 25-27 shot up to 31-48? Okay, well, we're starting to see a trend here. Okay, no coaching, no engagement in the health center. We're seeing, 0.8 conditions. That's great. It's a little less than all. But we just saw that monthly claim trend shoot up over $500 per member. And that 0 coaching makes up nearly half of the bucket here we're looking at. Now here's where it gets interesting. As we work our way towards the blue, we see that 1+ coaching visits. Okay, we've engaged this member in 1 coaching visit. Oh, $1,982 for this claimant. And they also have, we saw that chronic condition per member go up. All right, we'll go over to the 2+ coaching, $1,751 per member. And again, we're seeing that trend shoot up to 1.1. And kind of what we'll end on here, and it speaks volume, and this isn't an anomaly. We see this across the board with our book of business. That 3+ coaching, so it could be 3, could be 5 visits they've had in this calendar year. $1,821.20 is the average. We actually see 1.3 chronic conditions being the average here, which is a 0.4 increase from the all employees or a 0.5 increase from the 0 coaching bucket. So just, you can see this little bullet point over on the right. Despite being older, higher female, having more identified chronic conditions, all tending to increase claims, we're seeing a decrease in total spend. That is where the savings comes in on both the employer and the participant end. So with that, I would like to turn it over to Rosa de la Torre, who's going to get into some of our virtual care options, as well as Marathon's COVID-19 response and how that contributed both internally as well as our customers.
Great, thank you, Derek. I appreciate it. So during our very unprecedented 2020, start of 2020, we looked at the horizon and realized that we wanted to make sure we were prepared for what was coming. We knew that COVID-19 would eventually come to the US and impact our situation and definitely our employer groups. And so very quickly, when we first initiated our COVID task force, we were able to transition our services when the restrictions were put in place into virtual health services. And part of that included acute care, providing support through patients' illnesses, confirming that patients had everything they needed to be prepared for the pandemic, also having coaching visits, discussing what may occur if someone had fallen ill with COVID, and also accessing other health systems that were also supporting the pandemic response. That also included behavioral health. We were able to transition to our virtual service platform within a couple of weeks once restrictions were put in place, and quickly realized that behavioral health had to be virtual as well. We knew our patients were stressed. We knew that financial situations would also come into play, and employment issues and concerns would also come into play. So our behavioral health therapists were able to transition their services very quickly to virtual services as well. This is all through our EMR health portal, and where they would be able to sign on, schedule their appointment, click on their link, and be able to access any healthcare provider that they wanted to see virtually. Health coaching was also one of those things, including programming. We've been able to transition most of our programming, sessions to virtual sessions as well, along with individual health coaching. And so all of our services were enabled virtually initially during the pandemic. One of the biggest things what we realized when we knew that COVID-19 had now impacted the US, with having so many health centers in so many regions, we realized that we needed to have a designated task force that could meet on a weekly basis as things were evolving with COVID-19, and all of the changes and the updates that were coming from multiple entities, including the CDC. So this task force was created with several members, including our president, our clinical services VP, our chief medical officer, and myself, who was on the task force, to make sure that we were adequately prepared to not only support our team members, but also support our patients and our employer groups. And so this task force was enabled us to review all of the information that was coming from the different entities, review the research, and be prepared to make changes. One thing I have to say about Marathon Health is one thing that has really helped us is the flexibility that we have in trying to figure things out for both our populations and our employer groups. And that comes with having flexibility in what we can provide, understanding our employer groups, and being able to respond adequately. The other part of that was making sure our staff was also notified and involved in the communication. So timely communication was one of those things that was essential to the success of making sure that we were still able to provide the services to our client base. Communication was in multiple different formats. So not only were we communicating on a weekly basis, having a weekly all clinical call with our clinicians and our clinical teams, but we were also having calls with our customers as well, communicating what we were able to accomplish in the health center, how we were able to provide services virtually, and also communicating out to our patient populations, depending on how our employer groups wanted that communication to be sent. We also incorporated mental health webinar series. What we have found with COVID-19, as many of you may have, is that our employees, our patients are really struggling with a lot of things that have been going on. Not only the stress of constant worry of being ill, especially if you're a high-risk patient, also worrying about their work situations. And so we were able to deploy our mental health webinar series both through our health coaches and our behavioral health specialists, so that way our patients were well prepared from a psychosocial standpoint. And then the third part of our communication channel was really patient outreach. Our goal was to make sure that patients felt they still had access to their providers that they trusted and had relationships with. And also making sure that they understood what their risk level was, how we could best support them, making sure they had refills, medications, when their next labs were absolutely necessary, and when we could see them again in person. And so all of that was also linked to additional social service support and other vendors that each employer group has, including EAP and other social service vendors that our employers do use as well. So what were we able to accomplish during this time? Very impressive, numbers. Our clinical teams were able to reach out to 210,000 patient outreach calls. And out of those, we really prioritized those high-risk individuals, those individuals that were on chronic care medications that were essential for, their care management. We also wanted to make sure that they understood what had changed with their, their employer incentives. So what patients still needed to accomplish to receive those incentives and how we could best support them during the pandemic, especially during the restrictive lockdown, areas when we were not able to see people in person very well. And then out of those outreach calls, we really were able to create about 12,000 actual visits with patients, whether they were medication refills, appointments scheduled, rescheduled, moved to a better time when patients were accessible. We wanted to also make sure they had that supportive check-in. So we had follow-up visits as well that were virtual. And eventually, when we were able to open our health centers back up, then we were able to get those high priority patients in first so we could see them and make sure that they were meeting their standard of care guidelines and making sure all of those gaps were filled. So one thing that our task force also reviewed was how do we safely bring patients back, both from the perspective of patients who are high and chronic patients who are more at risk for COVID-19, and then also to keep our own clinical staff as safe as we possibly could. So we established 3 zones, red, yellow, green, and initially our red zone was during that time when primary care was sort of told to hold off on bringing patients in during the first wave of COVID illnesses. And so during that time, we were still able to support our patients virtually. And then now that we've moved into our yellow zone, we have opened things back up to providing incentives like biometrics and physical exams that are part of the incentive package. We also were able to make sure that patients were able to access flu vaccines and flu clinics. And so we wanted to make sure our first responders had all of their safety physicals that they require on an annual basis to be able to go back out there into the community and provide those essential services that were extremely necessary during this time. We also we participated in first treatment of injury. We also participated in events like screening events as far as COVID-19 screenings, so temperature checks, self-attestations. We are currently deploying our rapid testing model as well. And so all of that has come from our task force reviewing everything that's available, reviewing the research, and being able to identify those areas of highest need. And we soon will be moving to in some areas, green zone, where we are creating some protocols to be able to bring patients in or assess them, those with respiratory illnesses, now that flu will start soon, our flu season, and we want to make sure that patients have accessibility that is a known and a familiar face if they do fall ill with either any kind of flu-like illness or COVID-like illness. The other part of our task force was really to identify areas where we could best support our employer groups. We have a very diverse group of employers. Many are considered essential workers. Many are in manufacturing, food manufacturing, first responders, municipalities that have many first responders, and we wanted to make sure that we could provide whatever support they needed to be able to continue those services. And so our workforce planning was created. We also had some return to work protocols and assessments that we could deploy to make sure that if an employer that needed some assistance with assessing their environment to see where they needed to put additional barriers that would prevent COVID spread, that we were able to assist them with that and assess their individual situation. We once again were involved in actively monitoring some of those populations. So self-attestation processes, reporting, we're able to report to each employer how many virtual visits that are COVID related, maybe not COVID positive patients, but COVID related. We're able to let our employer groups know. So if there is that cluster of infections or potential infections, we're able to identify that and respond with our employers, communicating that to our employers. So that way they can respond adequately in that area. And then of course, one of the other pieces was just actively monitoring the patient population, doing contact tracing for those employers that needed assistance with that, where we can come in and assist them with any type of outbreak and then do the contact tracing. What we found was that a lot of the health departments just were not able to keep up with some of that contact tracing. So instead of it being within 48 hours of notification, some of the health departments were struggling to notify people, and it was extended to 5-6 days later. And so we knew that the sooner we were able to do some of that contact tracing, the better off the population would be, and there would be less community spread within that population as well. Prevention and sustainability, our commitment is really long-term. And so this approach is what we continue to evolve as we learn more. And so, as I mentioned, we are deploying our rapid testing, antigen testing system to those employers that need that. And we're able to support that option as well, along with PCR testing. So just a constant prevention, trying to figure out where we can best support that population and mitigate the risk to the community as well. Thank you, Derek.
Great. And now Matt Grebliunas with the City of Lewisville will cover a few slides for us.
Thanks, Derek. So yeah, I'll start talking begin with where we were prior to having our health center and some of the reasons that drove our decision to open a wellness center. So first off, our employees, we weren't utilizing the medical system how we should. Fortunately, the employees were not getting their annual physicals like they should. They weren't going for their biometrics. A lot of this was because they didn't have assigned primary care physicians, and we didn't have any type of formal wellness program. What we ended up doing, we partnered with a couple local physicians, and employees could go in once a year and get their annual physical and get that blood draw done. And then we would do some healthy challenges that HR would organize, but we didn't have any way to track our wellness or a strategy to improve health. We also, back in 2011, we actually switched from copay plans to co-insurance. So the cost for a doctor's visit ultimately was going to go up for the employee when they're accustomed to maybe a $35 visit. Now with the higher deductible plans and the co-insurance, they're looking at $80+ to go visit the doctor. So that was an adjustment for them as well. And then the cost of the plan for the city, the employer, to fund the health plan, that was continuing to rise as well. So while we wanted to simplify the medical experience for the employee, we also knew that we needed a long-term solution to wellness and to make that a priority, but while still focusing on acute care. So we really were looking for a solution to our need for a wellness program to focus on the employee health, help the employees save money, but then ultimately gain control of our overall claims cost and bring that down. So fast forward to January 2014, that's when we opened our doors to our wellness center with Marathon. We were able to open a 40-hour-a-week wellness center. We staggered the hours that they were open. So Monday, Wednesday, and Friday, 8 to 4, Tuesdays and Thursdays, 11 to 7. As far as staffing goes, it's Marathon employees. They're not employed by the city. We have a part-time physician, a full-time nurse practitioner, a full-time medical assistant, and a part-time phlebotomist. And then just recently, we added a part-time mental health provider to the team, which has been a great addition for us and the employees. Now, we do share this facility and the medical staff with the city of Capel, which is a neighboring city. While we do share it, it is an absolute unique experience for us and for city of Capel. So we have different incentives than Capel does. We have different plan designs. Marathon provides us separate reporting. We have our own contracts with Marathon. When we do our monthly meetings with the account team, those are done separately as well. Now, while things are kept separate, we still obviously have to communicate with Capel. We've got a great relationship with them. But for example, we'll look at the timing of programs so that we're not overlapping and overwhelming the medical staff. And anytime there's a change in medical staff, we're working together on getting the right person in there. Now, why did we even choose to partner with another city and have a shared center? Well, it really came down to we wanted to have a full-time facility. And the more covered lives you have, obviously that decreases the per employee per month cost. Us by ourselves or Capel by themselves, more than likely wouldn't be able to have a full-time facility on their own. And so we had gone out, we spoke to multiple cities and entities when we first were ready to move forward with this, and we ended up moving forward with city of Capel. It did work out well. We had obviously neighboring cities. So our wellness center is right on the border of the two towns. So it's a very good location, but we had the same vision and goals as Capel. So it made sense for us to move forward together. And we're trying to improve the employees' health. We're concerned about what the employees are spending on healthcare and the access that they have. And then obviously, just like everybody else, we want to control the cost of claims for the city. What Marathon was able to provide is being able to administer multiple plans and wellness programs under the same roof. And that was what really led our decision to go with Marathon. Now, it was always our vision since the beginning to partner with other entities or cities and share the services and share the facility. And now recently, Denton County is actually working with Marathon on opening a wellness center. And we obviously are in Denton County as well. And we have employees scattered around the area. And so by sharing facilities is going to be a great benefit for our employees. And so we're going to be in discussions with the county, talking about how we can share these facilities and what that'll look like to ultimately benefit everybody and our employees. So we're definitely looking forward to that. With that, Derek, we can pass it over to Lisa.
Thank you, Matt. All right, we now have Lisa Price from Marsh McLennan Agency that'll be closing us up here.
Hey, hi, Lisa. This is Rosa. I think you're on mute.
Oh, I apologize. I am so sorry. Can you guys hear me okay now?
Yes, ma'am.
Okay, awesome. So thank you, Derek, for the introduction, and I apologize for being on mute. I'm very honored to be here today and talk about our experience with Marathon. So I am also very proud to work for an organization that has missions and vision and value that we instill in our everyday activities that we share with our clients. And next slide, Derek, if you don't mind. So the next slide illustrates some of our key component areas that we help with our clients: compliance, consulting, administration, and communication. And I really like to hone in on that second bullet there, the consulting, because it's very important for coming up with a long-term strategy for our clients. So it's not only just focusing on what we can do for them today, but what we can do for them tomorrow and the years to come. And so when we looked at why we would put in a worksite clinic for our client, we looked at several different things. So overall, as Derek hit on one of his slides, what the first and second year investment. So you may not see immediate results, and it does take some time to get the results that you're looking for. So don't give up. And if you need to tweak things along the way, we can certainly do that with Marathon's help, because they are very nimble and flexible to work with the client. And then as far as a long-term strategy, it is highly recommended for a client to look at a long-term strategy, whether it's 1 to 3 years or 3 to 5 years, to really look at your healthcare benefits and where you'd like to end up and the different benefits that you can offer for your client or for your employees. And for location and accessibility, we also look at, do you have a location that is on your site, or do you have a centralized location that may be better if, doing a lease or a rental area in a building for your clinic? So our clients made arrangements to use one of their facilities and just do a rebuild on that, and it worked out very well. It was a centralized location for them, so the employees had easy access to the facility. And then identifying the risks and conditions. Rosa hit on some of these earlier in her slides. When we take the data, it's very important to have the services in the clinic really go back to your claims data for a relationship, right? So our client identified several areas like cardiovascular disease and diabetes and tobacco use. That was what their population needed help with. And in the long term, we were able to mitigate that risk for those members who were identified early on. And then through coaching sessions and wellness, we were able to help them reduce those risks. And then make sure when you're looking for a partner for your clinic, you look at it is a partnership, okay? And so it does require quite a bit of a long, lengthy RFP process, because you want to make sure that you're finding a vendor that works with you and be able to meet your particular needs. Will they be flexible? What's their reporting like? That's a really big point in what we were looking for, was the reporting capabilities, because again, that ties back to your overall claims data and how you can make an impact on that. And so that was very important. And then understanding the specific population, your employee population, as Matt mentioned, they're municipalities, and then my client is an oil and gas company, and so their workforce is going to be a lot different. So we want to make sure that the clinic staff understands the type of workforce that they're dealing with, so that they can better help them focus on their healthcare needs. And then having a clinic allows an employer to focus on what they feel is important to their workforce in regards to healthcare services, and it can really make a positive impact on the overall culture. And then I wanted to give you a little bit of a history for what our client went through, and we like to look at the clinic as a holistic approach, because we do look at so many different aspects of a client's needs. And that's why I love working with the larger self-funded clients, because there's so many things that Marsh McLennan is able to do for them, and unique things that really fit their needs to help them reach their goals and their long-term strategies. So we took a large self-funded client, and they were looking to add a value-add service to their benefits package. So we started looking at their clinic options early on in 2012, and actually we started the process in 2011, and their clinic opened in 2012. And they chose to utilize their TPA to start up and administer the clinic, and they used a local physician to staff the clinic through the TPA. So the client, as I mentioned, already had an existing building, and so they modified that to use for their centralized location. And then utilizing the TPA did have its challenges. If I could do it over again, we definitely would not have gone that route. They didn't have strong reporting capabilities, and there was not a strong checks and balances system in place for like staffing and the supplies and invoicing. And the staff was, they were not fully utilizing the electronic medical record system, so the physician would use a different system than what the TPA had, and so that was kind of a nightmare, actually. And as Rosa had touched on before, they really do a lot on the Marathon side for quality, and so without the data in the medical records, that's really difficult and challenging to do. So the challenges that our client faced, wow, we had a lot of them. I'm sure Derek was tired of hearing from us because literally almost every day we were on the phone. So after a few years of struggling, the client did make a decision to finally move to a vendor that was dedicated to wellness clinics and primary care clinics. And again, we went through a lengthy RFP process, and Marathon was selected. And so their clinic opened up in July of 17. And I would like to say that the transition was easy, but it was very challenging. The employees had, as usual, they were very resistant to change. So they didn't like the new staff, they didn't like the provider, they didn't like having to schedule appointments because the clinic was more or less like a walk-in type of clinic. And they didn't like having to go in to see the provider to get medication refills. So basically, they didn't like anything at all about the change that Marathon brought with them. And so it did take some time to work with the employees and the processes that they were not accustomed to. And so the success is fast forward to 2020, and while it has been a very unique year, to say the least, the clinic is running very well, and it has been for the last couple of years. Employees are engaged, they're utilizing the wellness challenges, they actually schedule their appointments, and we have time slots for walk-ins, and it's a key attraction tool for the company. It's easy and convenient to use. They do not charge a copay, and it's easy to be able to hone in on the wellness and coaching sessions based on their detailed reporting. So that's always a very good option. So where are they today? We've got an overall satisfaction rating of 93.2, which is amazing. And I feel like for 2020, that's even higher. And we have permanent providers in place. The clinic is fully staffed. And they're staffed with employees who understand the importance of customer care. So we're really fortunate to have that. Preventative care and screenings have increased, and our coaching sessions have increased as well in the visits. And the clinic has played a really positive role in the overall environment of the culture of the employer. And people that utilize the clinic actually are looking at it as their clinic, and they take pride in it. And that's a really great place to be. And the employees find it very convenient and easy to use. So the employees do not feel rushed at their appointments. And I think both Derek and Rosa hit on this earlier, where the time that you usually don't get the time with the provider, right, when you go to the doctor, and everybody has unique needs. And it's nice to be able to have a conversation with your provider around what's going on in your life and taking a holistic approach and the coaching and the wellness, because there's not a one size fits all. And again, that goes back to knowing your employee population. And so we're very fortunate that we have the clinic for the client. The other thing is, for the no cost benefit share, that does drive a lot of employees to the clinic because they don't have a copay, and all their family members also have access to the clinic. But it's really the customer service and the provider experience that keeps them coming back. And the savings in paid claims, they have resulted in no premium increases on medical premiums for the past 3 years. And I have to say, for a very large client that has some pretty decent sized claims over the years, we have done a phenomenal job with the help of Marathon and the clinic to reduce that. And so this particular client, as a result, they are evaluating on even adding another benefit for their employees and taking the savings that they've had over the years and opening up a child care clinic, daycare center for their employees. And so it really was a win-win situation. It didn't happen overnight. It did take some years to get there, but we are so happy that they did, and we're definitely happy with where they are now. And so the one thing I would ask of you guys is that when you're evaluating a broker, make sure that they're able to look at your specific needs and look at things from a holistic approach and really be able to fine tune your needs to fit your long-term strategy and not somebody telling you how it should be. So with that, I will turn it back over to Derek, and I certainly thank you for the opportunity to present today.
All right. Thank you so much, Lisa. All right. So thank you all for your time and attention. I'm going to keep it here on the closing slide for a moment and then get out of the slideshow. So again, we covered multiple items today, ranging from an overview of, Marathon Health Services, with a bit of an introduction into worksite health, although assuming many of you are familiar with this concept nowadays. You heard a bit about our COVID response, and approach both internally, working with various work streams, and then externally, how we worked in collaboration, not only with the public health department, with our customers, other vendors, brokers. Matt Grebliunas with the city of Lewisville gave you an overview of, the business case for a municipality on why Lewisville, entered into worksite health, some shifting they did with their plan design and the success they've seen, and the success that they're projecting in the future, even more so. And then from Lisa's spill on the relationship, and as Lisa mentioned, she and I have collaborated for several years now on, she hit the word challenge. So it's all a challenge, but we've rolled up our sleeves on many occasions, and we've done the due diligence, and the particular customer Lisa has referenced, is reaping some rewards of that, and that we're extremely glad. That's the success in the outcomes, that we aim to deliver every time. So I want to thank everyone for their time today, and I do believe these slides will be available, but again, you have our information listed here on the screen. So do not hesitate to reach out for any worksite health related needs or questions that you may have. Thank you all for your time.